What withdrawal symptoms happen when quitting smoking for bladder health? When someone decides to quit smoking, they may wonder about the effects on their bladder health. Withdrawal symptoms from nicotine can indeed impact bladder function temporarily, but the long-term benefits are significant. Nicotine irritates the bladder and can increase urinary frequency and urgency. When a person stops smoking, the bladder starts to calm down since it is no longer exposed to nicotine's irritating effects. However, the body needs time to adjust to this change, which can lead to some short-term symptoms. During the initial phase of quitting, individuals may notice changes in how often they urinate. Some might find they urinate less frequently because nicotine is no longer stimulating bladder contractions. On the other hand, some may experience a temporary increase in urgency or a tense feeling in the bladder due to anxiety or nervous system adjustments during withdrawal. Another symptom that may arise is fluctuations in bladder control. Anxiety and withdrawal jitters can create temporary tension in the bladder, potentially leading to increased urgency or even incontinence for a short time. Fortunately, these effects are usually short-lived and improve as the nervous system rebalances. Interestingly, studies show that within weeks of quitting, symptoms of overactive bladder, such as urgency and frequency, often decrease. This improvement reflects the reduced irritation of the bladder from harmful substances found in tobacco. Quitting smoking also leads to a reduction in bladder irritation and inflammation. Smoking introduces harmful chemicals that can irritate the bladder lining, increasing the risk of bladder cancer and conditions like interstitial cystitis. By quitting, individuals can reduce this irritation, leading to less bladder pain and fewer urinary symptoms over time. Moreover, quitting smoking may improve pelvic floor muscle function. Chronic coughing associated with smoking can weaken pelvic muscles, contributing to urinary incontinence. When a person stops smoking, they may experience fewer coughing spasms, which can help strengthen pelvic muscles and improve bladder control. The underlying reason for these symptoms lies in how nicotine affects the nervous system. Nicotine interacts with specific receptors that regulate bladder and digestive functions. Chronic exposure to nicotine causes changes in the nervous system, and when someone quits, it can lead to temporary dysregulation that affects bladder and gut motility. From the perspective of bladder health and cancer prevention, quitting smoking is highly beneficial. While withdrawal may cause some temporary urinary changes or discomfort, the long-term effects include reduced bladder irritation, a lower risk of bladder cancer, and improvements in urinary symptoms like urgency and frequency. It is important to quit as early as possible since lasting damage from smoking can lead to ongoing bladder issues even after quitting. In summary, when quitting smoking, individuals may experience temporary changes in urination, patterns, and bladder control due to nervous system adjustments and anxiety. These symptoms are generally short-lived, and the overall impact of smoking cessation is a positive one for bladder health. Anyone experiencing significant or persistent urinary symptoms during this time should consult a healthcare professional for personalized support.